spring is here, summer is on the way, so today is the perfect time to remind you about the importance of sunscreen. Dr. Deborah Manjoney joins us now because May is Skin Cancer Awareness Month. Good morning to you, Doctor.
Good morning, Molly. Thanks for having me.
Yeah, thanks for joining us. I think sunscreen, especially on our face, maybe in our arms, in the areas that are most often exposed, it's probably good to just get into a habit of applying it every day, especially this time of year.
It really is. It's so necessary in order to protect your skin. You know, skin cancer is the fifth most common cancer in the United States. And actually, about 1 out of every 5 Americans will develop some kind of skin cancer in the future. And melanoma, the most serious kind, is the 19th most common cancer in the United States.
Now, when you mention melanoma, is that the most serious, most deadly form of skin cancer?
It absolutely is. However, it's very treatable if it's found early. And actually, the good news is there has been a lot of progress in the treatment of melanoma, even when it's end stage or when it's been into metastatic disease. In the last several years, they've developed a lot of new techniques that work on some people, certainly not everybody, to really control the disease. So it's not as deadly a diagnosis as you might have thought it was several years ago.
That is some good news. And I want to talk about sunscreen because I see a lot of it there in just a second. But first, I think it's important for us to know and to ask how big of a role sun damage plays in skin cancer.
And it really does. It's probably the most important factor for the development of skin cancer. And, you know, there's a kind of a fun little app on your phone that you could download. It's free. It's called Sunface. And you just take a selfie with it, and you can see what you would look like in 10 years, 15 years, and 20 and 25 years if you aren't using sunscreen. And it's pretty scary.
Oh, I bet.
Also, that's a very good app because it has a lot of information about moles and the changes in your skin that you can see that will help you know if there's something that needs to get checked out right away. Of course, if you've been exposed to the sun a great deal, it really is important to see a dermatologist to have a full body skin check, possibly even annually, depending on what your risk factors are and family history.
I was hoping you'd talk now about sunscreens. To be honest, I think sometimes the SPF and figuring out the numbers and how much to use is what's kind of complicated about it.
I would agree. SPF, of course, is what we've all grown up hearing about. And the SPF really is talking about the UVB rays from the sun. And I have to say that you need a minimum of 30 probably on a daily basis. And so that's really important to know. More than 30 may or may not be, it certainly is a little bit additive. It may not have the importance as having a sunscreen of at least a 30 SPF, but even more important is to make sure all your sunscreen is broad spectrum. So broad spectrum means you have protection from the UVA and UVB rays. Most of us who are older can see a result of UVA rays from just driving along in a car. The left side of our face is frequently more aged than the right side because of the driver's side window where the sun comes through. And glass does not block UVA rays, even though it does block the ultraviolet B rays. And so broad spectrum means that you'll have protection from both UVA and UVB.
So
the other thing is the water resistancy. And so a water resistant sunscreen doesn't mean you can swim in it and still be fine, but it does mean you'll have at least 80 minutes of protection, even if you're sweating or if you're wet. But sunscreen really does need to be reapplied throughout the day if you're out in the sun, at least every couple of hours.
I didn't know if there are any specifics in front of you that you wanted to mention, but you just said broad spectrum is important. A 30 or higher should be water resistant. I also have heard the term Reefsafe.
Yes. So Reefsafe has gotten a lot of attention, especially in places like Hawaii and Florida, where you have a lot of people who are out in the sun and using sunscreens. Reefsafe means that these products do not contain any type of chemicals that can damage the living reefs where we have all of our underwater life, our wildlife. And so anything that's reef safe would be a physical type sunblock, which has titanium oxide and zinc oxide as the active ingredients to protect you from the sun. And so all of these on this side are reef safe. We've got a physical from Revision, but we've got color science, our powder one, Epionce, Harkendurn, which is a wonderful one, especially for men who are out in the sun a lot. It's great for sailors. The Epionce for the body or the face that's clear and not tinted, and Elastin also is as a tinted one that's really great for the face. And they range anywhere in price from $26 to $76. The nice thing is the revision ones are not just sunscreens. And even though they have chemicals, they also have antioxidants in them. And so that's what makes those very important, almost as a substitution for makeup if you want every day.
That's wonderful. We're going to talk about the discount you're offering in just one second, but quickly, you have an event coming up, and this is an opportunity for people to learn more about Coolsculpting as well as M-Sculpt.
That's right. Coolsculpting is the most popular way to reduce fat non-invasively, and it works very well. You can have treatment sessions that can help you reduce anywhere from 20 to 50% of the fat you may have in any area, and almost anywhere in the body can be treated with Coolsculpting. M-Sculpt uses high intensity focused electromagnetic stimulation to actually stimulate the muscle, so the muscle grows, and at the same time on the belly when we're doing it, the fat around the muscle has to supply some fatty acids for energy, and so you lose fat too. So that's a pretty incredible thing.
Yeah, both of those are wonderful, and even used in conjunction would be great. Dr. Manjoney,
Yes.
Thank you so much for joining us and talking about the importance of sunscreen and the great event that you have coming up.
Thank you, Molly. Always great to see you.
Good to see you too. And to emphasize the importance of proper sunscreen during Skincare Awareness Month, Wisconsin Vein Center MediSpa is offering 15% off of all of their favorites on sunscreen throughout the month. Also, a reminder about that great event, the Body and Booty Camp, for anyone who wants to learn more about Coolsculpting and M-Sculpt. They have great results. That is happening Wednesday, May 12th. There are several sessions with limited numbers to allow for safe contact precautions. As always, call to RSVP. The number is 262-746-9088, or check out all of their services on the website. It is wimedispa.com.